الله الرحمن الرحيم قال رسول الله صلى الله عليه وسلم قال أن تؤمن بالله واليوم الآخر والملائكة.
There is a wide variety of population around the world, and Islam is one of the culture that we will be discussing today. To provide Muslims the high-quality care, the healthcare professionals must understand the significance of the Islamic faith and their beliefs. It is the responsibility of the healthcare professionals to learn and be open-minded about their culture. This is for them to serve the patients the best that they deserve. What is the influence of Islamic religion in nursing practice? But before that, let's get to know the Islamic religion. Islam is a monotheistic religion, which means they believe in only one God they call Allah, and this was founded by Prophet Muhammad. A follower of Islam is called Muslim, and there are approximately 2.8 and 3 billion worldwide membership. But here in the Philippines, the Muslim population was reported 6.01% of the total population. The majority of the population live in Mindanao and nearby islands. Now let's proceed to the common practices of the Islamic religion. One of the common practices of Islamic religion is having 5 pillars of faith. The 5 pillars of Islam are the basic tenets of faith that hold the entire foundation in place. Every follower is obliged to pursue these values and imbibe them as it teaches the way of life and make it as a part of the routine. Another common practice is the Quran, which is said to be the sacred text of Islam and is believed to be the word of God revealed to the Prophet. And last but not the least is that Muslims are very well known in their practice, which is called Ramadan, wherein the whole 9 months of the Muslim year is devoted to meditation and spiritual purification through self-discipline. During this entire month, they abstain from eating, drinking, smoking, and sexual relations. The fast is from sun up to dawn. Would you believe that? So now let's proceed to the main topic, which is the influence of Islam in nursing practice. Muslim women typically prefer to have female physicians and healthcare providers, while men prefer male physicians and healthcare providers. One of the reasons is that touching between men and women is discouraged. Faith healing is not acceptable in Islam. It was revealed in the verses of the Quran, wherein healing physical ailments can be proved by the words of Allah. Vaccinations are encouraged. No restrictions in medications, the use of blood and blood components, amputations, organ transplantations for both donor and recipient, and biopsies when it comes to practices related to reproduction. All types of birth control are generally accepted in accordance with the law of what is harmful to the body is prohibited. However, there is a strong religious objection on abortion, which is based on Muhammad's condemnation of the ancient Arabian practice of burying unwanted newborn girl alive. If in vitro fertilization takes place, the destruction of fertilized eggs would be considered an abortion and not allowed. Another thing about Islam is that in Islamic law, blood is considered unclean. Therefore, menstruation girls and women are forbidden to perform certain acts of worship, such as touching the Quran, entering a mosque, praying, and participating in the feast of Ramadan. When it comes to modification of dress code, it is common knowledge that Muslim women and men should dress modestly. To preserve modesty and privacy from unrelated males, hijab is worn by Muslim women. For men, a turban is also worn at all times, as this represents a core article of faith. If it is necessary to remove the turban or hijab during the medical procedures, there are different options that can be used, such as surgical cap or hoods and long-sleeve jackets. For their practice in praying, which is called salat, healthcare professionals should give them time to pray as a respect to their religion. Prayer is an application of the faith that is performed 5 times daily, which is at dawn, noon, afternoon, sunset, and night. They face Mecca, Saudi Arabia, which is considered the most holy city in Islam. Prayer includes a recitation of the opening chapter, or called a surah, of the Quran, and is sometimes performed on a small rug or mat used expressly for their purpose. Providing care for Muslim patients, it is important to implement same gender, wherein if the patient is female, the healthcare provider must also be a female, and same with the male Muslim patient. You might be wondering why Muslim women patients prefer to have same gender as their healthcare provider. Muslim women prefer to have same gender such as doctors and nurses in order to follow rules of modesty in regard to the opposite sex. In their healthcare practices, touching between men and women is discouraged. Muslims follow a strict dietary practice. All products from pork, blood, or intoxicating beverages are forbidden. However, some can consume meat that has been ritually slaughtered by the process called halal, which means lawful to that which is permitted by Allah, which includes fruits, vegetables, and eggs. So a healthcare provider must be knowledgeable on what particular diet must be given to Muslim patients and make modifications on the diet plan they need. Delivering high-quality care to Muslim patients involves having an awareness of the ramifications of Islamic faith and Islamic beliefs. Nurses need to understand the implications of spiritual and cultural values for clinical practice. They should be aware of the need for modesty and privacy, the appropriate use of touch, dietary requirements, and the use of medications. Understanding Islamic beliefs will assist healthcare professionals in delivering appropriate healthcare in a culturally sensitive manner. This can be accomplished by understanding religious implications, perspectives on family, health, illness, diet, and the influence of traditional medicine and privacy concern. All healthcare practitioners should be able to provide culturally competent care. Due to perceived restrictions in medical care, the Muslim population may be at an increased risk for several diseases. These limitations may include gender preference of healthcare providers, modesty, and misconception about what causes certain illnesses. These limitations may develop as a result of Islamic cultural beliefs and practices. Though many non-Muslim healthcare professionals face difficulties when caring for Muslim patients, healthcare professionals should still be able to provide culturally competent care. Healthcare professionals can improve cross-cultural relations through training, openness, and awareness, and meet their cultural needs and expectations for them to develop a successful relationship with patients from each group. Cultural competence will surely help the healthcare professionals to understand and communicate with people effectively. So that's for our presentation on influences of Islamic religion and culture in nursing practice.
أعوذ بالله من الشيطان الرجيم بسم الله